I remember some time ago, John, whenever you're public speaking, keep your hands behind your back or in your pockets. The other one was don't drink milk or coffee before, because it thickens up your vocal cords. So what have I just done? Had 3 cups of coffee and it's showing. So thank you. I notice the first thing that I have to change is in the very first line, 45 minutes. I don't have 45 minutes, so... What I'm going to do is that under the legislation there's a requirement to report on what we as a sector have achieved in gambling harm minimisation over a period of time. And so one of the first things that I was tasked with was to actually do some thinking about actually the ministry delivering on this outcomes report. So that's what I'm going to take you through, is a few snippets, and the high level ones, and ones I hope will be of interest to you. The full report is about 70 pages. It will be available online. I was hoping this morning, but I just checked before I came in and it's not up on our website, but it should be in the next day or two. It's on my top of my list to do when I go back to the office this afternoon, is to get it up there. It'll be fully publicly available, and I'm more than happy to take any questions via email about the report, should you have any, and it'll be fully in the public domain for you to use. So I'm going to take you through some headlines, and I'm going to ask you some questions, because this report has informed our thinking about what needs to happen over the next 3 years. The report includes a bunch of things which I'm going to show you. Some of you may remember that the original KPMG report published in 2013 had how many indicators? Does anybody out there know? 65, all right. Chocolate fish. Too many. I think it's what somebody else said. So we're down to a lot less than that. And we've reframed how it works together. What we have done, which some of you may actually find interesting, there has been for the last 15 odd years a mantra around let the statistics speak for themselves. I've never quite bought into that argument. And what we see is a bit of a turning around, actually providing a brief commentary about what the statistics are showing and what does it mean for policy and operational decision making. And I'm certainly in that space. And so some of you, when you read the report, might actually like to have a look at that interpretation, discussion and conclusions, and I'm going to give you a heads up about what's in it. Here is a new logic model. All they're effectively done is to try and make things coherent, is reorganise the 11 objectives that are in the strategy. So do you recognise these 11 objectives? They're the ones that you've been operating under for the last 3 to 6 years, not longer. What you'll see in here is a little bit of tightening of the wording. What we have here is that I've reorganised them into themes. So objectives 1 and 2 are about people and communities are better off. These objectives, I think, are suggesting about enabling people and communities to reduce harm. Services are accessible. You see a theme here. These are all messages that came out in the minister's video and in the strategy. System supports change. And so the document is organised around these things. Over here, the strategy for many years has talked about, and this is as much a legislative thing, sector as a whole working together. Now, who's the sector? And you're not allowed to answer. No, I mean, I'm looking at a particular person down here. So who's the sector under the legislation? Sector includes yourselves, agencies, that's DIA, Ministry of Health, and gambling providers. So there are 3 components to the sector, the gambling sector, that the ministry thinks about. And what we're all working to is to prevent and minimise gambling harm and to reduce gambling harm related health inequities. Now this is written into the strategy, the issue of inequity, so it's right up there. The new Ministry of Health direction, and under this government and our new Director General, Dr. Ashley Bloomfield, has re-emphasised this issue of inequities. So, are we making progress in reducing gambling harm inequities? This was a cartoon in the local newspaper, and from a little while ago, 2017, and I'm sorry, I saw it and I couldn't help but laugh. But I also thought, how sad. So a whole bunch of things went through my mind. So there's a guy sitting here. If you read the rest of these cartoons, this guy is unemployed. Can you hurry it up? The first race kicks off in 20 minutes and he's in the local loans department. So it's both funny on one level, and another level it's incredibly sad, and it's directly to the point because this is classic harm, classic addictive behaviour, classic enabling of the wrong sort. And I'm also aware that through a pilot project and trials called Sorted Whānau around building financial capability, that we have initiatives in place that, let's say, if this person comes into your service with gambling harm, where finance is an issue, which invariably it is, that there is a service available that actually enables budgeting advice type service to actually address them around the financial consequences of gambling and what you can do about it. So, first aspect around what has been achieved is that the independent assessment by Superi, this is publicly available, will be publicly available, actually it's already up on the website, is that more work is needed. Basically, Superi argued, and Superi are an independent research, health research group that includes policy work. They're based out of Wellington, they have offices in Auckland and Australia and what have you, is that that there are many opportunities to learn from best practice within New Zealand to create more pilot service models, to improve intersectoral relationships and make better use of the skills available within the industry as a whole to support those harmed by gambling. When they used this word industry, they weren't just thinking about yourselves, they were also thinking about the gambling providers. There are areas where they thought that the sector could work better together. One area that came up was the whole issue around host responsibility. Another one was around MVE, voluntary multi-venue exclusion practices. We have around non-casino gaming machines, i.e. the pokies, being located in the most socio-economically deprived areas. And things that, for some of you long-standing issues around the distribution of the proceeds of gambling and where do they going into community groups. So these are all areas where the independent needs assessment said sector as a whole could do better on. Harm reduction. So what has been achieved in terms of harm reduction? This is from data from the New Zealand Health Promotion Agency Health and Lifestyle Survey. It is survey data for these years. And what we see here is a fairly consistent pattern that gambling participation in the total population, particularly since 2012, remember I'm a researcher, so I'm a bit of a pointy head, okay? It's exciting news. The 2018 results are released up on the QPay data website yesterday. So I'll give you the web link to that. It all showing the same thing, that gambling harm as a proportion of the population has plateaued. It's pretty flat around about 5% of the total population in what we have down here. And these are the problem gambling severity index classifications. So what this is effectively telling you is that approximately 65% of the population gambles recreationally, and what we have up here is the moderate problem gambling end. So, key question, challenge I have for you, harm reduction has plateaued, the need for a refocus and revitalisation. And that's the challenge. Throughout the consultation period, the phrase refocus and revitalisation was constantly used. Well, I hope you saw and heard that. And this is the reason why. It's because the stats are telling us that harm has plateaued as a proportion of the population. We also acknowledge that the population has grown, so the actual numbers gambling and what have been suffering harm have increased. But in terms of what's happening in the population as a whole, so the question is, do we need a refocus and a revitalisation? I sometimes get asked questions about, John, what is the current levels of harm in the population? And so I wanted to put this up. This is the most reliable estimates that I will give you. Is that this is what is called estimates from a flash word called meta-analysis from the Health Promotion Agency, HLS, which I asked to be done. And it's a tool for bringing together data across multiple years that have been asked in the same way to try and work out where the central points are. And so what we have in here is, in terms of the population, 65% a non-problem gamblers. They're routinely gambling though as recreationally. And so we're talking around about 0.5% diagnostically can be classified as a problem gambler. What does that actually mean in terms of numbers of people? And you would have heard that Minister Salisa mention this in a video. So what does that actually mean in terms of people? That in 2014 population numbers, 23,000, 24,000 people. Yes, down the back.
So are you saying, do you want us to refocus and revitalise? One suggestion that I might give is to include children, because as the kids can research and what you're saying is coming through, then we need to be much more proactive with children about what they're experiencing and what gambling is and gaming is and how it crosses over. So whereas we have a limited ability to service 14 and up, 14 and below are being affected. So that may be an area that we need to be more aware of.
Yes, that's exactly what I'm saying. Just one area is that, and there is in the next couple of weeks, Pacific Island Family Study Youth 2017 research will be published that talks about the influence within Pacific Island families, their experience on gambling and what it means for youth in those families. Once again, the themes are consistent. The early onset exposure is really important as to how you think about alcohol use, drug use and gambling use. Yeah.
Do we have an ethnic breakdown of those statistics? Because we've talked about the general population, but we know that services in that subpopulation.
Yeah. We do have Maori and the wide definition around Asian, and I'm quite happy to talk about Asian, and I'll show you some shortly, particularly in the context of inequities. This graph I just wanted to show you was to actually give you the real sense. These are the numbers of people that we're thinking about in terms of service utilisation, because I want to come back to the service utilisation question. So what we have is there is a 2014 population estimate numbers, about 60,000 people, who can be defined in the PGSI as a moderate risk harm of gambling. I want you to remember these numbers. What we have down here is that Kahu and Eileen, and some of you may be aware, something that I put together is what is a range of the types of interventions associated with each of these population groups. But for this presentation, I want you to remember those numbers. As an aside, this is not entirely an advert-free zone, but I'm also a pointy-headed researcher that is quite excited about this, because I'm conscious that the big written reports don't often meet your needs. I'm very well aware of that, and I'm completely sympathetic. What we have done, I've worked with the Health Promotion Agency to say no more big written reports that come 18 months, 2 years after the data is collected. Is that I want these to put on an interactive website for you. I'm not going to show you the website, but it's up and running and live, and for those who get emails from me, you'll see that my email signature has this on it, coupe.hpa.org.nz. And what they've done is in the last 8 months launched this new website that has the results of all the different components of the health and lifestyle survey, so alcohol, gambling, healthy eating. have a look at it. And this, if you click through onto the gambling one, you can see statistics around these types of gambling activities. I won't show you the rest of it, but it includes tables, graphs, all of which you can download as figures or as Excel worksheets for you to do your own stuff with and for you to use. And I was told yesterday that 2018 has been loaded. I've yet to check if it's completely available at the public facing end. Certainly I can see it, but I'm sort of thinking, where's Rebecca? I need to write something for a news for the sector, letting you know about what's available, how to access it, and to take your feedback. So I'm really excited about this because it gets this information to you where you can access it yourselves for your purposes. Well, I hope you find it useful. Okay, I'm going to move on to another question. So we've just looked about what we've achieved in terms of working together as a sector. Superior have said we need to do better. I've also looked at the question around harm reduction in the population as a whole. And what I've said is that there has been a harm reduction. And from 25 years ago, there's been an enormous reduction in harm. But over the last 6-7 years, that harm reduction has plateaued. So we've asked the question is, do we need to refocus and revitalise our harm minimisation activity? So that's the question that I've posed for you. I'm going to now move on to talking about a little bit about a reduction in gambling inequities. And this comes back to your question down the front of the room. What we have from the international research and New Zealand research, that inequities in gambling are real. It's not a question at all. The question's answered. The inequities are there, they exist. What we have here is a thing called odds ratio analysis, which is a particular form of statistical analysis which is quite common in health research. Over several years of health lifestyle survey data that after adjusting for a range of socioeconomic factors, so that's age, gender, ethnicity, looking at education, and gambling predictors, that when compared to European other, we see a diverse picture. What we find is that the Asians group of risk is greater compared to European other at the moderate risk problem gambling end, and it's 9.5 times higher, so it's huge. Maori group are a second greatest risk at 4.7 times higher. And these are the confidence intervals, and so they vary. The risk of Pacific peoples is 2.4 times higher. And statistically speaking, it's not significantly different from the European other. On the low risk side, the risk structure changes quite a bit, is that the risk for Pacific peoples is 3.5 times higher. Once again, this is compared to Europeans. Asians is 2.7 and risk for Maori is 1.93. What the hell does this mean? What this tells you is that the patterns of gambling and the associated harm are quite different between the different ethnic groups in the population. What this effectively is saying is that when Asian groups gamble, they really gamble at the most severe end. Get the most harm, is one of the take-home factors from this.
Do you think that has a link to disposable income?
Well, this is adjusted for those sorts of things, so I'm not prepared to rule that out, but no, there's other things going on. So effectively saying that there are cultural dynamics going on in here about acceptable forms of gambling and types of gambling, I think is what it effectively says. And we know that a lot of Asian groups and with the casinos. The way the research is done, what other forms of gambling are taking place behind the scenes, but that's what our current thinking is largely is. There is, basically I've got to be a little bit, Sean, you might have a little bit of insight, but basically we have adjusted, and it simply says, our thinking is it's cultural factors around gambling. Yeah, absolutely.
But you've mentioned the justice plan.
Yeah. Okay, want to move on, reduction in gambling inequities. I'm going to show you another graph, and this graph is around service utilisation. In terms of overall gambling use, the HLS shows that Asian population underutilised services compared to other ethnic groups. And the odds ratios, once again, for those who contact gambling services, what we can see here is basically this number suggests that Asian population simply are not accessing services. Pacifica are more inclined to ask for services, and Maori definitely do ask and access for services. But Asian, this is way too low. It should be, minimum, it should be a number of 1. That it's 0.3 is significant underutilisation. Of these odds ratios, the Maori results were statistically significant at 99% confidence interval. Okay, another way, a lens or way of thinking about inequities is, and Minister Salisa in her video clip mentioned this, and this actually comes from DIA data, is inequities by socio-economic deprivation. Look, over 6 years, very consistent patterns. Approximately 50% of all poking machines are located in the 3 most deprived socio-economic areas. This is a huge, we would argue, inequity, social inequity. Superior in their needs assessment have got a wonderful one line that effectively says the most deprived economically, socially, are getting the least money returned to them in gambling proceeds, and they're paying the highest price in terms of the harm. So in terms of inequities, we think there's a real issue here, and what do we do about it? And Minister Salisa acknowledged that in a video clip. And that's the question, and some of you may remember that a question about this was specifically asked in the consultation process, and the question was put there at the direct request of Minister Salisa and Minister Tracy Martin for DIA.
And
Yep. This is groupings. So New Zealand can be carved up into 10 categories of economic deprivation. And so that 3 most, I should have said 3 highest categories, the 3 most highest categories, the most deprived categories. So I'm not talking about, I haven't identified geographic regions, but basically those regions are those that represent deprivation. Going to say, are they publicly available? They can be made publicly available. Maps have been produced showing the deprivation index of gambling venues. Sorry? Yes. Advert time. DIA have done a wonderful job on revamping their gaming industry statistics. And this was updated about 12 months ago, and this is what it currently looks like. And they've done a terrific job. So here's the web link to it. Go to it. You can download a whole bunch of figures, graphs, Excel spreadsheets for your work. And it covers off a whole bunch of stuff that you can see in here. I'm not going to spend any time on it, but it's well worth looking at. Inequities, again, I'm going to move on again, is around another way of carving. You talked about Maori and Pacific, is that what we can see here is inequities. In health terms, there's absolute, and there's talk about absolute inequities and relative inequities. And what this graph shows is that since about 2010, there's been a reduction in the absolute gap, but relatively, we can see Maori, Pacific, Asian, Maori and Pacific in particular, remain with the highest inequities in terms of gambling behaviour and associated harm, though this 3.8 is half of the 6.4. Okay, so there's an absolute reduction. the size of this gap here compared to here is shrunk considerably. So that's an absolute reduction. Relatively though, this represents this group of gamblers, and for these population groups, and you can see that these population groups still remain the highest groups with the most inequities. Okay, so absolutely reduction, but in terms of relativity, the differences remain. That's what this graph is intended to show you. So a key challenge question I have for you is, how do we address these levels of inequity? Now, I put up a slide that gave you some numbers, and I asked you to remember the numbers around moderate risk and severe problem gambling level. And those numbers were around about 24,000 and 60,000. This graph shows you service utilisation. And we're talking about total clients, this blue line here, new clients and existing clients, and this is for all interventions. And we're looking at around about 12 to 14,000. So is there an underutilisation of services on the data that I've presented? Yeah, absolutely there is. And what we have is the same graph. Now this is click data. This is available, and Sean Paul does a great job in our team. I'm regularly updating this off the Ministry of Health website, so you can download this yourselves as a graph. It comes down as a JPEG file. This is excluding brief interventions. Okay, so our conclusion is that current service utilisation is substantively lower than could be expected given estimates of gambling in the population. I want to note that service users are approximately 16% of those in the moderate problem risk categories. These low levels of service use have been reported before. They're not entirely unique to New Zealand either. Okay, it's been found internationally, and here's a couple of references. So once again, key challenge for us over the next 3 years are these levels of service use appropriate? And how do we address it? This once again goes back to the opening statements around refocus, revitalisation, need to rethink our service design and delivery. I am running out of time, and I'm just going to try and think, can I show you, I'm not doing too badly, but I see a few glassy eyes out there as well, is service awareness. Is basically, where are we at? Trying to think what might be of most interest to you. You're not going to be able to see them. I'll try and speed up for you. Service, one of the things is that around raising awareness of services. HLS says that generally, that in the population, people were generally able to spot the signs of gambling harm happening. That's a good news story. And here are some examples. I hope that you'll be able to cite these off if I asked you the question. Don't ask me the question. But these are effectively coming from the problem gambling severity. And so 90% of all respondents said they could correctly identify 3 out of 5. I think that's a pretty good result. However, room for improvement in awareness of where the service is available. While they are aware of spotting gambling harm that might be taking place around them, that didn't necessarily translate in knowing what to do about it, or where to get help from. So that's all we're effectively saying here, and this is what it actually looks like, is that there was actually good awareness from amongst the most impacted by gambling, particularly around the 0800 helpline at 81%. But you can see that it rapidly falls off. So it's direct linear effects here, is that all respondents, so this is generally the population, 65% are aware of the helpline, but as we go down the different types of services, Asian Health Service, Kelly. I don't know what the number is amongst the Asian population around the awareness of Asian services, but this is a challenge for, I think, all of us, for the ministry. Once again, back to this question of awareness around gambling, where to get help, access to services, use of services. What this says to me is, as the evaluation advisor to the ministry is, and to thinking about HPA activities, about there's room for improvement in here, and we need to rethink how we promote awareness around gambling. And basically that's the conclusion that I've got there. So you will see that there's constant theme, or the same themes are re-emerging through different lenses. You'll be pleased to know we're nearly done. Gambling harm has reduced substantively over the last 25 years, but it's plateaued over the last 6 to 7 years. Inequalities and inequities have reduced, but they're still there. I haven't spoken about any of the stuff. In the report we talk about aware, enabled and resilient communities. The key point is clear that no surprises to anybody in this room, it's a challenge to do this. System change enablers, superior needs assessment in particular talks about this. Issue around benefits of professionalisation of the workforce, improvement in the gambling industry around host responsibility. You know, there are discussions taking place with HPA and DIA around this space. Current harm reduction activities should be reviewed and reinvigorated if further levels of gambling harm are to occur. That's the overriding conclusion, which has helped inform the way that we've gone about the strategy and its consultation. And some of these messages the Minister has accepted and acknowledged in a video. Thank you very much for your patience and for your time.